diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The following programming is furnished by you and your doctor.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Ant2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, everybody. I'm Greg Keeley. Welcome back to another You and Your Doctor program sponsored by All County Healthcare, always here for your home health needs. We're Medicare certified, serving Miami-Dade, Broward, and Palm Beach counties for more than 20 years. Well, tonight we have a very special guest. Pleased to introduce Dr. Eileen de Grandis, a vascular surgeon in Boca Raton. Doctor, we appreciate you being on the program so much tonight. You've had a very busy day, I am sure. You went to school in the Northeast, according to your CV, and you're also in the upper Midwest. Are you from the northern part of the country originally? Yes, and by the looks of it, you have quite a CV. You went to medical school at Temple University and then a residency and fellowship at the Mayo Clinic in Rochester. Could you tell us a little bit more about your background?
Teachers shape the future. Right now, in a classroom somewhere in the United States, there's a teacher inspiring a future scientist who will make preventing pandemics their life's work.
What's happening?
Sharpening the mind.
I think I got it. Go.
Hello there, back again. Wanted to go over this briefly as we could. We can hear you a little bit better now. You had mentioned earlier that you had gone to school in the Northeast and the upper Midwest. Are you from that northern part of the country originally?
I grew up in the Midwest in North Dakota.
I got you. And there was a rumor going around, I think you started it, that you're actually born in the great state of Nebraska. Is that true?
That is true. I spent at most about a year in Nebraska, and then we moved around. My dad was a professor of chemistry, and I ended up in North Dakota. And from there, I did most of my college actually on the East Coast in Philadelphia. And then I came back to the Midwest because I loved it so much, to Minnesota for my training at the Mayo Clinic and the University of Minnesota.
Well, that's fantastic. As someone who was born and raised in Nebraska, I knew that I liked you immediately, being from Nebraska. So thank you for that. And it sounds like you've traveled the world some already. And I wanted to make mention that you're board certified in vascular surgery and a registered physician in vascular interpretation. And that sounds like a very key component of what it is that you do. Could you expand upon that a bit? It no doubt assists in a more accurate diagnosis, correct?
Yes. As a vascular surgeon, I'm RPVI, the Registered Physician of Vascular Interpretation, which means I look at all of my own imaging. I order CT scans, and it makes me a radiologist of a sort. I look at ultrasounds, I order ultrasounds, I can do on-table imaging. So it makes me a lot more hands-on. I don't trust someone else's interpretation. I can look at the images directly and know what's going on with people. And that is helpful for a lot of our patients. I can get the results almost immediately. I don't need to wait for reports if they get their images in a place that's not related to the hospital, or if I'm not doing the images myself. And it really speeds up care, and it's a lot more continuity. There's a lot more consistency with understanding the images directly, as opposed to waiting for someone else to figure it out.
Mm-hmm. Well, that's fantastic. And how much of a difference do you believe that actually makes in continuity of care? People need that accurate diagnosis quickly so you can move on for treatment. How much do you think that speeds up the process?
I think it speeds up the process quite a bit. There's a lot of radiology centers here that are excellent at what they do, but there's not always an on-call radiologist or a radiology tech that knows specifically what vascular studies are needed. It helps me talk a lot, too, with radiologists when I do order something that someone else does about what I'm looking for. That way they don't waste their time doing an image that I don't need. And that way it's also very helpful to the patients. They get a lot less dye, they get a lot less radiation. And I think in terms of making the overall care more comprehensive and enhancing the team approach, where all the providers who are working with the patient, the radiologists, the primary care doctors, and myself, I think it leads a little bit to more of a team approach, as well as an overall better understanding of what's going on, seeing the patient as a whole person versus just one specific problem.
That's amazing, and everyone is looking for more efficiency in healthcare, and you decided that was what you were going to do, and we can already tell that you're making a positive difference in the lives of the patients who you serve, and so that's quite admirable. So you had mentioned that your dad was a professor at the University of Nebraska-Lincoln in chemistry, so obviously science is a big part of your game moving forward. How much of a positive influence would you say that your dad may have had in your decision to pursue healthcare?
Well, he was a full professor in North Dakota. He was studying for his professorship in Nebraska, and I remember being very little, and he was a huge influence in the sense of he really wanted us to understand the world. I remember being about 6 years old, and he brought home a microscope, and we all had fun poking ourselves and putting it on slides and just taking a look at the cells just to see how things worked. And I remember going outside to the nearby pond and just grabbing pond water just to see what was in it. And I think that made me very curious about how things work in the world, and I think that carried forward to medicine. Medicine is very much discovering how people work. Everyone works slightly differently, and what challenges that diseases cause, that how we age, and how aging changes how we function in the world, and what disease processes develop. Not only what we get from other things like bacteria and infections. So I think having that natural curiosity early on was very helpful. I think it stayed with me, and it definitely influenced my desire to go into medicine, which is a science field.
What a fantastic experience to have your father then, in essence, as a role model, which would assist you in being more curious about everyday activities and making that kind of ingrained in your lifestyle. And now look at you now, you're making such a difference for patients. It's quite impressive. And so as you move forward with your obtaining your medical degree, and that you had decided on vascular surgery. What was it that what compelled you to want to be a vascular surgeon?
So I wanted to be a vascular surgeon. This sounds very strange, but vascular surgeons were the surgeons when I was at Temple. They were the surgeons other surgeons called for help, and I didn't know why. It was because vascular surgeons are very talented in knowing the anatomy of every part of the body. The only part of the body vascular surgeons don't operate on is the brain itself and the heart itself, but we operate on every other part of the body because we are the plumbers. We treat circulation problems that come from the big blood vessel of the heart called the aorta down to every blood vessel it feeds and the circulation that comes back, and that's naturally nearly every organ and every limb and part of the body. And I found that absolutely fascinating, and it wouldn't limit me. I wanted to help as much of a person as possible. And the only way to do that is to be able to understand the person as a whole and to be able to work on and to operate on every part of the body. And I really liked the challenges that it brought. I liked that I would have to and I wanted to see the person as a whole. In surgery, it's very easy to just see people as components. Well, I only work on the kidneys, or I only work on the legs. I wanted to work on everything, and that might have been predominantly why I chose vascular surgery.
Oh, that's impressive, and also there's a brain component there too. Could you speak to that some?
So one of the things that I work on, and a lot of vascular surgeons treat, is we treat the two big blood vessels to the brain called the carotids. And this is a major cause of stroke. So if these blood vessels, and it's plumbing, if these blood vessels become clogged, sometimes the plaque or the atherosclerotic disease, the calcium that builds up, can break off and go into the brain and cause strokes. Sometimes these can form clots, and they can go up to the brain. And other times it can just cause like changes in vision or other abnormal symptoms, such as the inability to talk, like I just had, but an inability to talk.
Join the club.
Like atypical stroke-like symptoms. And what I do as a plumber is I clean it out. I can open it up with stents, which are little metal tubes that can fit inside, or I can open the neck with an incision and clean out the plaque and patch it closed so that we don't run the risk of having a stroke. And strokes are really debilitating. They say it's 40% of people with a stroke will have a major stroke the first time they have a stroke, and that's really it's really life changing for a lot of patients. They sometimes don't recover terribly well. A lot of people won't be able to go home moving their arms or their legs or being able to walk. They won't be able to understand or be able to talk or to function the same way that they did before the stroke. And I think that's really important. One of the surgeries we do, the carotid endarterectomy and those stents that I just discussed, they go a long way in preventing stroke and treating a major cause of stroke. And it's one of the reasons why I find what I do very rewarding. We can do preventative surgery.
That's outstanding. And I guess in that same vein then, what are your particular areas of interest, would you say?
Well, I as a vascular surgeon, I treat the entire circulatory system except for the heart tissue itself. I don't treat muscles or the brain tissue because I don't treat brain tissue. But I treat the carotids, the aorta, which is the big blood tube that feeds all of the organs in the body, including the legs. But what I really enjoy is what most of us in the vascular world call limb salvage. I enjoy finding out why patients' legs hurt so much when they walk or when they move, and fixing the problem to help people walk better with less pain. A lot of this is, I feel that walking without pain is a really important goal for a lot of people as they get older. Plaque disease builds up. You can't walk and do the things that you want to do. It really greatly affects quality of life. So fixing the problems in the circulatory system with legs, limb salvage, preventing amputation, preventing open sores, really can improve how people live in their latter part of their life. And I find that extremely rewarding.
Well, just listening to you, and I think our listenership today can detect a lot of passion and a lot of love in what you do, and I think that probably most has certainly attracted patients to your practice because they know they're going to get all of your expertise and just that tremendous dedication that you regularly provide for them. So that's quite impressive. And what age range of patients do you normally treat? I understand it's quite a range.
Oh, I treat patients from about 20 years old into their hundreds. I think the oldest patients I've ever treated was about 105. She was a good 105. She put most 100-year-old patients to shame. I think she was still running every single day too. Well, how about speed walking? At least a couple miles.
That's phenomenal.
And I find that here in Boca in Florida, there's some really youthful older people, and they want to stay active. My younger patients tend to have more genetic disorders, vein disorders, but my older patients, they just have the circulation issues that come naturally with age. But that doesn't mean that there isn't anything we can do. We can always, of course, improve circulation if it becomes lifestyle limiting, if it keeps people from doing what they want to do.
Understood. Well, so a question then, I guess a follow-up pertaining to that. Is there a typical type of patient you might treat that's often associated with type 2 diabetes?
Type 2 diabetes is often correlated with obesity. I do treat diabetic foot ulcers. Diabetes is a very insidious disease. A lot of people don't know they have high blood sugars until they start having kidney problems or circulation problems. Sometimes they'll have a wound that doesn't heal because the blood sugars are high. When I see patients in the office, I often treat them for ulcerations or non-healing wounds in their legs. Or kidney disease. When I see these non-healing wounds, I do a full physical exam. I assess them comprehensively. I look at not only what's their circulation in their legs, but I listen to their heart, their lungs. Everything's related. And a lot of diabetic patients do have these wounds largely because diabetes accelerates the formation of plaque disease, which narrows blood vessels and can cause difficulty walking, pain with walking, cramping. They can also develop sores. Obesity, which is associated with diabetes, can also cause vein disease where the patients develop large varicose veins or swelling, which can also cause pain itself. So diabetes is a very insidious, and it's a very dangerous disease in the sense it causes many different problems, all of which can greatly affect the quality of life.
Well said, and we appreciate your insight on that. We are all ready to take a quick break. That went fast, right? We'll be back with Dr. de Grandis right after this.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Well, welcome back to You and Your Doctor, sponsored by All County Healthcare, a Medicare certified company. We work with patients in Palm Beach County, Broward County, and Miami-Dade for more than 20 years now. Led by owners Lou Biazzi and Delroy Clark and their dedicated team, we're located at 4850 North State Road 7, Suite G103, Lauderdale Lakes. And our main number is 954-717-7027. And so we are back with our main attraction tonight. She is Dr. Eileen de Grandis, a vascular surgeon located at 670 Glades Road, Suite 100 in Boca Raton. Her office number is 561-955-3500, where her dedicated office staff will get you all lined up for an appointment. So, Doctor, you talked about the detrimental effects of some of those insidious diseases that you had mentioned earlier. And boy, you want to talk about an insidious disease. As you had mentioned earlier in today, all the ramifications of COVID-19 and the challenges that providers are now facing. There are many other important services that you provide, and dealing with COVID is one of those because of the blood clot scenario. Is that correct?
That is correct. I think in the last 2 years we've seen a lot of complications related to COVID. Most of them are respiratory and with the breathing issues, and that's really gotten a lot of news. But what people fail to realize is COVID is also, it's an inflammatory condition that can cause blood clots. When I see patients in the hospital, and what's actually, when I've seen patients in my office after patients recover from COVID, there is an increased incidence of people with blood clots in the legs, strokes, heart attacks, not only from the stress of just having COVID, but from the fact that it's an inflammatory condition that can inherently make the blood clot itself. About 20 to 40% of the COVID patients who end up in critical care on advanced breathing tubes or in the ICU end up with a significant blood clot. And we're talking about, again, strokes, heart attacks, or blockages in blood flow to the legs that can cause gangrene, or blood clots in the veins that can break off and go to the lungs and cause what we call pulmonary embolus. These are all, the incidence of that is quite high, again, 20 to 40% of critically ill patients. When they come out of the hospital, they still carry with them this propensity to clot up to, and I'm seeing it up to, 6 months to a year after they leave the hospital, that they're still dealing with the complications relating to these clots. So it's not well advertised, but it is very present. And the reason I like bringing it up is everyone worries about the blood clot risk when you have the vaccine, but that risk is extremely low. I think the incidence was 12 and 24 million when they looked at the AstraZeneca vaccine. But when we're looking at, say, 100 people who go to the ICU with COVID, about anywhere between 20 to 40 of those patients will have blood clots, and that's to me a much higher rate than worrying about something from a vaccine that's extremely rare.
My goodness, yeah, that is very telling, isn't it? And the importance of vaccinating and masking up and doing everything that we can to protect not only our life but other people's lives.
Yeah, so, absolutely. I think we all need to do our parts and be careful for each other.
Absolutely. Without freedom, you can't have freedom without responsibility, right? It makes total sense.
Yeah.
Another thing that we touched on a little bit was the sedentary lifestyle risk component for folks, and clotting that can occur with that. Could you talk about that issue some?
Yeah, so, and not only COVID, but I think not only patients with COVID, but I think in the last 2 years it's been very hard for people to do the things that they once did. I've noticed, too, that patients have gained weight. They've lost, a lot of people have lost the ability to go to the gyms because of the pandemic. So people are in general less active. When you're less active, you sit around more, are more likely to have blood clots because what we call stasis or inactivity, or the blood just pooling and not moving in your legs, can cause blood clots. And this can cause patients to have complications. They can need blood thinners for a short time or a long time, depending on the severity of the clot. These clots can also break up and go to the lungs, causing that pulmonary embolus or difficulty breathing. We can treat these in a number of ways. The most common is blood thinners, but we can do clot-busting treatments if the legs become really swollen, what we call lytics, and we can put filters in as well to prevent blood clots from going to the lungs. But we really want to get to prevent all of that, and I think a lot of it is just encouraging people to try to stay active even at home. I tell people that even if you get up to go to your kitchen 20 times a day, as long as you're not eating something every single time, that as long as you get up and just walk to your kitchen 20 times a day, that's better exercise than just sitting on your couch for 6 hours and not moving. When we look at studies of activity, it's definitely not length of how much people walk. It's not like a mile or 2 miles, but it really is the frequency of how much people get up. So someone getting up to go from their couch to the kitchen 20 times does better than a person who just goes on one walk a day, even if that walk is much longer in distance than the 20, the length of the time 20 times to your kitchen. Again, as long as you don't eat something all 20 times.
Right. Yeah, that's usually the strategy for some of us, I know. And so one final question. We're going to be wrapping up. This has gone so quickly. We have about 2 minutes left. What is it that causes ankles to swell? Do you have any insight or theory on how that happens as a vascular surgeon?
Well, there's a lot of causes for ankle swelling. Sometimes it's gout. Sometimes it's inflammation. Arthritis can certainly cause it too as well. I see a lot of patients in my office for venous insufficiency, where the veins that bring blood back up to the heart, they don't work very well because the valves that push the blood back up or keep it from coming down, they get loose, and then the blood pools in the veins and the ankles swell. This is certainly very treatable. As the director of the vein center here, I do treat that quite a bit. It can make people feel significantly better because you can retain a lot of water in your ankles. Like if you have cankles and you have them in both legs and the swelling goes up to your knees, people realistically can hold 5 to 10 pounds of water weight, and once they get that water weight off, people feel lighter, they feel better. Everyone loves to lose 5 pounds. But it also makes them walk easier. Imagine strapping a 5-pound bag of flour to your legs and having to walk with that. That's really hard. So it's certainly very treatable. I would encourage people to, if they have sudden swelling in their legs, see their cardiologist. Sometimes high blood pressure and heart issues can cause swelling. But if your primary care doctor thinks it's a vein issue, I'm happy to see patients in my office.
That makes sense. Okay, well, we appreciate it so much, and want to say thank you so much for all that you do for patients. We couldn't help that you are a very highly rated physician within your specialty. Health grades rating 5 stars, vitals rating 5-star. It's very obvious to us that you are earning the trust and appreciation of your patients. So South Florida is extremely fortunate to have you as a surgeon here, and we appreciate all that you do for patients and want to thank you for taking the time today. Thank you so very much, and wish you all well. Stay safe and stay healthy.
Thank you for having me.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the...
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
This is the FM Money Talk